Welcome back to Vibes by Alicia, the lifestyle show that helps women 40 plus with lifestyle tips to enjoy their 40s to the max through education, conversation, and inspiring interviews. This podcast is here to empower all of us to be badass no matter where we are in whatever stage in our life. So today we are doing an emergency, a kind of like a urgent episode, just because so many people have been reaching out to us and wanting to know more information. As you all know, this past weekend I posted a story on my Instagram about a medical scare that we had. But we really definitely want to go into it a little bit more because we are getting so many DMs. And I think the most important way for us to kind of reach all the DMs and all the people that are asking questions is just to do one episode. You can listen to it, go back to it, and share it with your husbands. I think that's the one part that a lot of women are sending me. They're like, I need to hear this because I need to send it to my husband because he does not listen to me. He does not want to go to the doctor. He does not want to get checked. So, okay. Rusk is here with me, my husband. Rusk.
Oh.
And Rusk had a medical scare this past weekend that we were totally not expecting. I think, if anything, our doctor said something like, oh, it could be very dire. It could be very serious. And we just kind of looked at each other like, oh, she's just exaggerating. But she wasn't exaggerating. She was right on point.
No, she wasn't exaggerating at all. It was because I'm like I explained to the doctor earlier that I'm kind of very centered, but even kill kind of guy, but I work out a lot. I left the shop 5 years ago to kind of get my health back on track. You had convinced me to sign up with this direct primary care business model. I was a little skeptical, but it was working out great for you. You introduced me to what I think is my life savior right now.
I think so
Dr.
too.
Sonia Singh. It's by far been the best thing that I've done over the last 7 to 8 months. And so kind of fast forward to the predicament was several months ago, I just started experiencing shortness of breath. And
so we're in July, and this happened
in probably about February or March.
2023.
Right, somewhere around that time.
Yeah.
And leading up to that, for about the last 18 months, I was on workout supplements because I was doing some pretty intense workouts.
Yeah.
I was doing cardio for an hour, and then I was going to the gym for an hour after that. And so I needed, some energy. And got to meet Dr. Singh, and first thing, in our first primary consultation, she tells me you need to get off that stuff. And so I threw it away. And then immediately my performance started going down, maybe about 6 to 8 weeks, because as a doctor will explain, that stuff takes a little bit of time for it to wash itself out of your system. And so I just thought it was that. And when I was going to these cycle classes, I noticed that my performance numbers were dropping. I was no longer number one in the class, and that was absolutely driving me crazy. And my son was beating me. That was driving me even more crazy.
I know. Our son is 20 years old.
And so there were some days that were better than others, but I was having shortness of breath. And so prior to that, in January, we had done a residential project that a lot of construction, a lot of debris. So I just thought I inhaled a lot of sheetrock and dust and thought maybe that was the case. But it was kind of manageable. And to fast forward over the last several months, the shortness of breath wasn't really bad until we end up in Rwanda.
Yeah.
We're now in July.
Yeah.
And we're climbing 8,000 feet, 9,000 feet, 10,000 feet, and I can't breathe for shit.
Yeah.
And I've climbed some mountains before, Machu Picchu, Cotopaxi in Ecuador. Never, and those are actually higher. And Cotopaxi was like 12,000 feet.
12,000.
And I didn't have this kind of shortness of breath back then. And Alicia was looking at me like, how are we going to make it to the top? We're only halfway there. And, here's the crazy part. All I'm thinking is how much I paid for this. I said, I am determined to make it to the top. Because I didn't think I have anything wrong with me. I just think I'm high elevation. I think that maybe the workout stuff wasn't working anymore. Maybe there's something wrong with me. But on the way down, I had the same problem. And then I didn't still think there was that much wrong with me because I'm thinking in my mind, I'm at 9 or 10,000 feet. Just took some very long flights.
Yes.
One to Europe for 9 hours. I only had a day and a half in Amsterdam to recover, still a little bit jet lag. And now I take another 8 or 9 hour flight to Rwanda. I'm jet lagged, right? Then I get to Sicily, fast forward 4 days. I can't climb a flight of stairs without absolutely losing my breath. And then I knew there's something wrong. And that's when I had texted Dr. Singh here. I was like, I need to come and check this out. This is not normal. I'm simply just going up 10 steps and I can't make it. So luckily, this is all pure luck in my case. I think it is. Maybe doctor will chime in here in a bit and tell me, well, all the working out you did probably helped your situation. and some other fortuitous things probably happened after that. But
Mhm.
as soon as I got back in town, went to see the doctor, and she ordered some cat because so we bump into each other heading up into her office. We're in the elevator,
Yes.
and she's not telling me anything, but then she tells me a little bit later that your breathing in the elevator wasn't normal by simply standing still. Trained ear, trained eye, trained vibes or whatever. And so we're going to get you a CAT scan. I
Mhm.
go to the CAT
Mhm.
scan. At least you and I
Yes.
are on this. We're on this. This is going to be a respiratory infection. It's going to be probably
No, I
long
thought it
term
was like long-term COVID
COVID,
because he
right?
never had
Virus,
COVID, but I figured he always had it. He just never got checked
right?
out, Dr. Singh. So
And
that's kind of
and
where
here's
I
my
was
deal:
coming
is
from.
I've actually been doing this cardio to prevent what I think is clots. Because I know from an athlete in high school football, that coach said you got to keep it going from high school clots. Then you kind of read later on that athletes get clots too, but different circumstances. So I'm doing all this cycling just so I don't get a clot. It's like this can't possibly be a clot. And of course, the doctor calls after the CAT scan about 20 minutes later and tells me you don't only have clots, you have them in your lungs, and then they're in your main arteries, in both lungs, not just one lung. And I was like, I just lost my shit after that. I
Yeah.
mean, I didn't know what to do. Doctors called me. I had to process all. I had to take. I just need to get off the phone with the doctor because she's like, talk to me, talk to me, talk to me. And she's doing what she's supposed to do. I was like,
Yeah.
I need to register this for a second. So that's when you were in the car
Yes.
with me, listening
Yes.
on the speaker,
Listening to everything.
and then, but what went back in my head was a flight of stairs in Sicily. I said, I think the doctor's right. I look at you. I said,
Yeah.
not that I was trying to. I'm just not. I just didn't. This was coming out of nowhere. It's like having you find out your kid has cancer at 15 years old. It's kind of like a major curveball. So
Huge
and
curveball.
so we're going to the ER today.
Yeah.
So we went to get my son from baseball. We packed our stuff and we went to
And
the
we went
hospital.
straight to the hospital. But I want to preface all of this before I introduce Dr. Singh, our doctor, our PCP, and the founder of Juniper HDX, with the concept that Rusk and I were never on any medication. We never were on any I never even took birth control. We were so adamant about staying off medicine, being as healthy as possible, working out as much as possible so we can do preventive medicine so that we didn't have this situation happen to us today. We did everything we could correctly. I came to see you when I was having menopausal issues. We took care of it. I was having hypertension. You and I worked it out. I didn't have to take any meds. I'm still not on any hormones and I feel great. I feel amazing. I'm going to be 48 next week. So I want to preface all of this conversation with saying that Rusk and I have always been as healthy as we could possibly be, our way of life. But the one thing I will bring up is that Rusk had a very high stress job from the age of 21 to 45, 46 probably. Hyper stress. I think for me, I was worried that he was going to have a heart attack at some point because he had such a stressful life. It was a 60, 70-hour work week for him. I don't know if that contributed to it. I think Dr. Singh will add a little bit of that to it, but that's the only thing that I can think of that gives me a reason why he would be sick today. Because other than that, I don't understand it. I think we're just completely bewildered by this whole
We were
thing.
shocked. It was just, I mean,
It's a shock, and I think we're still kind of a little bit of a shock. But I think this conversation today is because we're getting so many questions on people want to know, like, what should we look for? Okay, so Dr. Singh, you see us. Russ comes in to see you last week. Dr. Singh is a PCP. She also has a concierge service. She's evidence-based health and lifestyle. You will find her at Sonia Singh MD on Instagram. And if you want more information, she's at www.junipermodernprimarycare.com.
Yeah. Well, thanks for
Welcome
having me
to
and letting me be
our
your PCP, trusting me with your health.
podcast.
I mean, I think Russ's story starts like way before that, and this all speaks to like the importance of having a PCP in the first place. Like you guys were doing
Yes.
everything right in terms of your lifestyle and the things that you were in control of. But I think establishing that relationship with a doctor as early as you can as an adult makes a huge difference. So to me, the story didn't start in the office visit or in the elevator or even when he texted me from Sicily. It started just meeting Russ, like you introducing me to him and saying, look, he doesn't really love going to the doctor. He hasn't seen one in a long time.
Absolutely.
He just wants to get a few things checked. So, having that context of knowing him a little bit better, knowing you guys, knowing his personality, that helps me interpret everything else that happens. So when he texted me from Sicily, I know he's not the kind of guy that's going to run to me with every ache and pain and say, I think something's wrong. So to get a text from the other side of the world of somebody saying, I think something's not right, I don't feel good, immediately then, my little alarm bells were ringing. Like
little
something.
antennas start going.
The little antenna went up,
Yes,
yeah. So then coincidentally, and I'm so glad it happened, we just bumped into each other in the parking lot and walked to the elevator, and I saw him walk just from the car to the elevator, and we were chatting about his trip in the elevator. And I was just looking at his breathing and thinking like, that doesn't look right. And then again, it was like ringing, something's not right here. We sat down and we're chatting. And when he was sitting, he looked fine. And he was also like, I'm going to cycle bar. I'm doing this. I'm like, there were a lot of indicators that he was doing fine. And I took him back to the exam room, kind of started checking him out. His lungs sounded really clear, which to me was actually kind of a bad sign. If I had heard bronchitis, pneumonia, something gunky in there, I would have said, oh, okay, you got an infection. We're going to treat this,
Yeah.
But they were completely clear. Oxygen, okay, but a little lower than I would expect for someone, healthy. And also, I know Rusk and I know he's fit, and I know he exercises a lot. I think if he had walked into some random place where they didn't know him at all, they'd be like, guy is for late 40s, overweight, maybe he's just out of shape. Maybe that's all. And I knew that was not the case for him. Like this was not his normal breathing. This is not normal functioning for him. And then again, knowing his personality, there are some patients that would look exactly like that. And I would say, I think you should go to the ER right now and get a scan. I would have said that to some people, like my really anxious types who can't wait and, are really like, oh my God, something might be terrible. I would have sent them. Knowing him, I was like, he's felt this way for a few weeks. He's stable here right now. He's going to think I'm insane if I tell him to go pack a bag and go to the ER. Yeah. So let's start with some testing. So we started with the testing, and every piece of information I got after that was like, I think he has a clot. I think he has a clot. And it was one of those times where as a doctor, you kind of have like a little crystal ball where you're like, I can see where this is going. And I knew that you could not see where it was going. Obviously, you had no reason to.
In the blood work, what was one of those first indicators?
D-dimer, right?
Yeah. So we did a full set of blood work when he came back because so many things can cause shortness of breath. I mean, severe anemia, kidney failure, heart failure. I mean, so many things. So we did a full set of blood work, and everything was fine except for this one test called the D-dimer, which is a test that helps us decide if someone is not obvious slam dunk blood clot in the lungs and you're going to send them for a scan. If you do that test and it's high, it pushes you over the edge to say, yes, we got to do it. And if it's normal, the vast majority of the time there's nothing there. So you feel more comfortable saying we can wait and continue searching for something that's causing this. So when that came back high, truthfully at that point, I was like, he has a clot. Like I felt very, very, I would have bet money on it. I felt very confident. And so I told him like, okay, we're going to get a scan now.
Yeah.
And then the next day, he had scheduled the scan for the evening. The next day I was like, okay, it's going to be like 7 p.m. The radiologist is going to call me. They're going to tell me there's a clot. And then I'm going to have to call Russ and tell him, you have a clot. You have to go to the hospital.
Yes.
And I knew that was going to feel like such a sudden, like you said, like just a total curveball. So I think I texted you sometime in the afternoon, and I was like trying to mentally prepare you. I was like,
you
look,
did.
this you're gonna get this scan.
Dr. Sonia Singh, you're mentally preparing us, and we're over here like, oh my gosh, she's such an exaggerator.
You did the right thing because you read my personality correctly. As much as I don't want to hear it, I did need to hear it because
you did need to
not
hear
telling me not preparing me for it would have been even a greater curveball.
So I knew you didn't like it in the afternoon, and I knew you weren't gonna like it. But I was like, I have planted the seed now. He has it in his mind that I might call and say this. So, in that afternoon before we even had the scan, I was like, look, there's a good chance tonight I'm going to call you and I'm going to tell you to go to a hospital. And I know that sounds crazy because you've been on an airplane, on a mountain, like at Psycho Bar. You've been doing all these things. And I'm telling you,
active.
You have a medical emergency. That sounds insane.
Especially when you don't feel any symptoms.
Right.
Except the
you
shortness
did
of
have
breath.
symptoms.
I did have shortness of breath. I just didn't feel like I was sick.
There was no pain in his chest,
Yeah,
for example.
yeah, you didn't. I mean, if you Google pulmonary embolism, you're gonna see like high heart rate, pain in the chest, pain in the chest, all of these things. And he wasn't a textbook
He wasn't
case.
feeling any of that.
So
I'm a strange human being, by the way.
yeah, yeah.
We know that.
So anyway, we had that conversation in the afternoon. He didn't really like it. I knew that, and I was fine with that. And then lo and behold, I knew the scan was at 6. I think at like 6:30, the radiologist called and texted me and said, I need to speak to you, and gave me the results of the scan. And I was hoping like maybe it's a small clot, maybe I can squeeze by without sending him to the hospital. And she was like, no, it's very extensive. It's in both lungs. It's in the main pulmonary arteries.
Wow.
So a lot of times they don't even let you leave the facility. But I had put in notes like, he is clinically stable. I just saw him yesterday. Like I emphasized that. And the other reason, this is again speaking to the power of direct primary care. The other reason I felt comfortable doing all of this with you is because I knew I could text you anytime and you could text me anytime.
Yes.
So I texted you multiple times between the day I saw you and the scan being like, are you okay? Everything fine? Everything So, when you're...
I don't mean to cut you off, but I just want to reemphasize that.
Yeah.
Do you see how this works with the direct primary care model? You get to text your doctor directly. This is not, you're not texting a nurse or a PA, medical assistant or something like that. And Dr. Singh had already reached out to the CAT scan, to the imaging place, and has put in the notes. I mean, all this preemption was, minutes, hours of saving, and that they weren't prepared for that. I may have not got the results until the next day. Right. Who knows where I could have been. So all these decisions by Dr. Singh to expedite the process and make it more efficient was critical at that time.
Super.
Right. So it's important, and being able to text. This is because I'm a bougie guy. I'm all about customer service.
Oh yeah.
I mean, over the years I've gotten worse about this stuff. So when Alicia told me you can just text her directly, that sold me right there. Because we've all gone through doctors where even my parents. I mean, and my mom has an earache. It's September. She needs a blood test. It's a Kelsey Siebold. It's October before she gets anywhere. And I mean, I get to text Dr. Singh, and here I'm doing a CAT scan tonight, and 30 minutes later, I'm talking to her. Yes. I'm not talking to some nurse that doesn't have half the answers. Right. Let me get with the doctor. Doctor calls me for 30 seconds, and then I'm talking to the nurse again. It's fantastic, by the way.
No, it's amazing, and I think the reason why we were not so sold on the primary care is because we're so used to how our parents get care, and they're elderly. So they go to the hospital, and then it takes me 3 or 4 calls to finally get to a doctor to give me something as a feedback, right? And when I found you and I met you, and I was like, oh, she will actually text you right back with results, and she will guide you through them.
It's the greatest thing ever.
It has never happened that way. And I guess because we're so used to taking care of our parents where they're on Medicaid or they're on supplemental B insurance where they're just ignored.
Continue, doctor. I didn't mean to cut you off. I just want to throw that in there.
There's just a difference.
How critical that was in hours, because when I got to the ER, the ER said it could have been any minute.
Yeah. So I got the result from the radiologist, immediately called you guys, and basically, tried to explain you've got clots in the lungs, both sides. It looks very extensive. It's pretty serious. And the safest thing for you to do at this point is to go to a hospital to start your treatment. And I remember, I was hoping that Alicia was listeing to, or that you would let me talk to her,
she was on speaker.
Sometimes when I can't convince the person, I need to convince their spouse. Right. So I was glad that both of you guys were listening the whole time. And again, I know you were just like, but I'm fine. Are you sure? Are you fine? I mean, if that result hadn't come straight to me and me called straight, I feel like you would have been like, are you sure that's my lungs? Like, are you sure that's me? Right. Because you just didn't feel as bad as that scan looked. And so I was worried that you were going to not want to go, but you told me 20 minutes later, we're headed to the hospital. We're going to go, which I felt good about. And then I'm fortunate enough to have a relationship with Methodist. So I'm able to see everything going into the chart and orders going in and notes going in. And then I can upload documents. So I immediately uploaded the faxed report of your CT scan. You were smart enough to take the CD with you, which was awesome.
That was my father, by the way. That was decades of experience. He texted me, take the CD.
Always
scan.
Take the CD.
Yes,
Always take the CD.
That was his experience. I got to give the credit to him, but go ahead.
Yeah. So then as soon as I hung up with you and you said you were going, I called Methodist. I spoke to a lovely ER doctor, gave him the full story. And the guy kept saying, but is he stable? Are you sure he's stable? And I said, you know, he was number 1 in cycle bar this morning. He's going to be okay until he gets there. And you know, then I had dinner plans that night. So I went out, I was texting the whole time with you guys. And when I came back, I logged into Methodist and I looked at the chart and made sure, you know, he was getting admitted and all the things were happening. And
this is like 10 p.m. at night, by the way, guys. I mean, where do you find a doctor that does this at the 10 p.m. at night?
Yeah,
4 a.m. the practice is closed.
No, it's absolutely.
You know, something like this happens to one of my patients like maybe 2-3 times a year. So this is not a common thing. I'm not doing this every single day. But when I know the patient and I'm so invested in them, like I want to know, like, are they getting the right care? Are things getting done? I also didn't want him to get 1-2 things done, get booted out, and then suddenly I'm scrambling to, you know, do the rest of it for you. So, I mean, it like I said, I did a post about this. It's like, it didn't feel like work. It was so natural.
So Dr. Singh, what are the consequences of not getting checked out for this? Because a lot of ladies that are texting me or DMing me, they're like, my husband has these same symptoms, but he just doesn't want to go into the doctor. What are the consequences of somebody not going to see a doctor or the ER room?
Well, I mean, I would start by saying a lot of different things can cause shortness of breath. And that was really the only symptom he came to me with. So, I mean, it could be a multitude of things.
But why did you say it was dire?
After the CT scan?
Yeah. No, I mean after the blood work.
Because I knew after the blood work, I was very confident that it was a clot.
Okay.
And so, you know, again, a lot of patients I would have just sent straight to the ER at that point. But I was like, I still think he's going to think it's dramatic. Let's just try to get the CT and confirm.
Because I'm anti-drama, guys. It's good context.
Yeah.
I'm the one that brings the drama.
Yeah. So I was trying to keep things calm and just kind of, I mean, I knew he had already had this for weeks. Right. So in his situation, you know, if he said this symptom started for me yesterday, I wouldn't have given him any breathing room. I would have said, you go right now. Right. But the fact is he had this for a long time. Yeah. So it didn't happen yesterday, and it seemed like it wasn't progressing, you know, very obviously. So if you do have, you know, a pulmonary embolism and you ignore it, I mean, the mortality, like death from pulmonary embolism is, you know, 10 to 30%. So you might not even get to the point where you realize you have something. I mean, it could just hit you quite suddenly. And then if you've got, you know, one that's survivable and it's just sitting there like Rusk's was, it puts stress on your heart over time, and it puts stress on your lungs. And so you can develop heart failure, you can develop pulmonary hypertension.
And those are permanent, right? Or at least long-term?
They're long-term, yeah. Right. I mean, once that stuff starts changing, it's not an easy thing to...
It scars the organs.
Right.
That's what, right.
Right.
Remember that's what the cardiologist told me.
Yep. Yeah. And so, and then, you know, if you still have clot in your leg, as you did, you know, there's also the possibility that more clots could travel to the lungs and, you know, cause additional stress that you don't have already. So, I mean, it's a do not miss kind of situation.
I think what Alicia was asking, just to rephrase it, not necessarily the shortness of breath, but I think some of our friends probably have different sets of issues.
Yes.
And how to, you know, how do you convince them that, I mean, this is kind of what the essence of this podcast is, that it could be lingering in you for weeks, for months, and then one day it just sneaks up on you. Right. So it's
right. Yeah. Right.
Medicine.
So, I mean, my answer to that would be, if you're not sure, you should always get it checked out. Like, you don't most people do not have the medical knowledge. I mean, we go to school for a really long time to be able to look at somebody like you and decide what to do.
Yes.
So it's not reasonable to think that you plus Google is going to be able to replace that. Right. Yeah. And I think what holds people back, it's a lot of things. It's like the hassle of it. It's being like, well, who should I go see? Is that person someone that, you know, is going to be good? Can I trust what they say?
Yeah, I think that's part of the problem. I think
there's the, you know, cost. You don't know how long you're going to have to wait. You know, well, if it's the appointment's 3 weeks from now, like, whatever, I guess I'll just wait and see what happens because it might be gone by then.
Yes.
What about the psychology of bad news?
Oh, that's huge.
Right?
I mean,
people just don't want to hear it.
Denial is like a powerful thing. Right. Yeah. And I think I see like two kind of broad categories of people. Yeah. I am like the anxious type of, like, when I feel fear or anxiety about something, I'm like, let's figure it out. Let's prepare as much as we can. Let's check every test.
Of course.
And I think there's another, you know, type of person that's more like avoidant and is just kind of like, I'm not going to think about that thing. I'm not going to let it, I'm not letting it bother me. I'm just going to keep going, keep pushing. It's going to be fine. It'll go away. And, you know, when it doesn't, at some point they come in and see me. But it's really important for me to have an idea of what that person's personality is as a patient, because that helps me of interpret when, you know,
So, Dr.
something
Singh, if
else.
they're feeling some of these symptoms, what if they're feeling some of these different things? Like maybe they're dizzy, maybe they're having shortness of breath. I know Rusk and I just kind of like threw it like, oh, you just had a tough workout. Oh, you just like, it's the altitude. Like we
Mhm.
just kind of like find excuses for why we don't want to accept when something is really, really bad, right? And it just came to a point where Rusk was like, I just really feel like this is just
Yeah.
not something
It's not normal.
normal.
Right.
I just
Mhm.
don't
Right.
explain it. I
Because
can't explain
because
it.
I think a lot of the times, or friends, or I mean, just you yourself personally, it's passing. You'll have an ache in your leg, or you'll have a pull in your back,
Yeah.
and then psychologically, all that information builds up in you over the years. Like, oh, this is just going to pass. Just it's just taking a little bit
And I
longer.
think our brain
Right.
creates these excuses for it,
Oh
right?
yeah.
So that we don't accept what's really happening. Because I think that's what happened last week. We're like, oh, she's exaggerating. There's no way. She's going through the worst case scenario. There's no way it could be anything like that. Like you're so healthy.
Well, it was the worst case.
It was. But I think what I want to just convey to my listeners and to the women out there that are just sending me all these messages is please, if you do not feel like something is right, if you think something is wrong and your body is telling you on a consistent level, please go get it checked out. There's no reason why you have to keep
What do you
waiting for something to happen.
What do you tell most of our friends are in their 40s? Some of them are
Yeah.
50s. What do you tell
40s and
What do you tell these
50s.
guys that not necessarily shortness of breath? What's something they should look for in a particular, just generally speaking? I know the medical textbooks
There's
are
so
thousands of
much.
pages, but you is it how long after something that doesn't go away? I mean, is it?
Mhm.
I know you can say, well, it depends this, and this. It's like in wine. You
Yeah.
say, well, wine tastes like this from this region, but from this
Yeah.
region, there's no right or wrong. What do you tell a guy in his mid 40s or mid
Yeah.
50s after day number 4 or day number 5
Okay.
or day number
Well,
after a
okay.
month?
Well, I'll tell you two big things. I would
Right.
say one is anything that feels out of the ordinary for you. If you get a cold that just doesn't feel like any of your previous colds, or you get a
Uh-huh.
headache that just doesn't feel like any of your previous headaches, that's always a reason to go ask somebody something.
Mhm.
Most of the things I see in primary care, coughs and colds, musculoskeletal aches and pains, truthfully, even if I did nothing, they would get better on their own. They're most of the time they do get better. Most viral infections will, peak around 5 to 7 days, 2 weeks. Usually you're pretty much back to normal. Most musculoskeletal things, throwing out your back, getting some, strain or spasm or
Yeah.
something from activity. Those things sometimes linger for 4 to 6 weeks, but at 4 to 6 weeks, if it's not getting better, you definitely should go in. That being said, there's a lot of red flags that can happen before 4 to 6 weeks that would
Yeah.
indicate to you,
Okay.
okay, you got to go see somebody earlier than that. But, musculoskeletal pain, viral infections, those are like very big common things that a lot of people experience that I see a lot in primary care and that usually sort themselves out. But if
Mhm.
they feel different than the ones you've had before, you should always, get them checked. But I think the bigger point is get a primary. Just get a primary that you like. Get somebody that you feel comfortable that you can reach out to and ask the question. And I think the problem with our healthcare system is that we just put so many barriers between the
We
doctor and the
do.
patient, and we make it hard so that you have the tendency to say, well,
I don't
I'm
wanna
just
do
gonna
it.
wait and see, and
Yeah.
I'm
Right.
just gonna tough
Yeah,
it
'cause
out,
you're
and it's
just not
fine.
willing to deal with
Or
that.
you're afraid like they're gonna, just give you some script medicine, something that you don't want to take, and. And I also want to emphasize, like, I don't think Russ did anything to cause this. Like, I think you
Yeah.
guys were doing everything right. You can be doing everything right with
Yes.
respect to your diet, your lifestyle, the way you're taking care of yourself, and things can still go wrong, And
Mhm.
it's very hard for people to believe, especially people who I think want to opt for non-medication, like natural treatments. They're like,
Right.
well, but what can I do to fix this naturally? There is nothing Russ could have done to fix this naturally. Like, this
Mhm.
was not something that
It was just a free
Yes.
kind of deal, right?
yeah, and we're gonna investigate it further, but we cross our fingers that this was just bad luck and there's nothing else that
Sure.
caused this.
Unprovoked, right?
Unprovoked.
Yeah.
Yeah.
So like you mentioned headaches. If headaches linger, you said musculoskeletal viruses. If they don't alleviate after a couple of weeks, 2 to 3 weeks, sure. What about like chest pain or what are other things you see in guys in their 40s and 50s that if it's lingering too long, it's probably
That
something
they
more
chalk
serious.
to like,
Okay,
oh, it's just
guys
natural
in their 40s and
aging.
50s should never let chest pain linger. Like chest pain,
Right.
Maybe a woman in her 20s who has an occasional something going on in the chest can sit on that for a while. if you're a male and you're already in your 40s or
Yeah.
50s and you have any type of risk factor, family history, your
Mhm.
weight, high blood pressure, a lot of people don't even know they have high blood pressure because they're not checking it.
It's a silent killer.
Yeah, right. So, I mean, for chest pain, I would never sit on it. That is always something that should be evaluated.
What
Wow.
about abdominal pain? Same thing, right?
These are really broad categories.
Right, I know. But you mentioned appendicitis the other day. You had a patient that was kind of sitting on it for a while. And
Yeah, again, I mean, to her, it was like, well, the pain's not that bad, I'm doing okay otherwise. I'm still working, but because of the story she was telling me, the location that she was having it, the associated symptoms, the fact that she didn't sound like she had a stomach flu or some other kind of GI bug, I was like, that sounds like an appendicitis. And then I saw her literally 2 hours after she had texted me, and I did an exam, and I was like, you definitely have an appendicitis. And that
Wow.
night she had her appendix removed. But again, like that really is not about her deciding whether those are concerning symptoms or not. Like she has Google too. Like she was like, I Googled it, and I think, it's in that same area, but like, I don't think I have the, my
Right.
pain's not severe enough. And it's not.
You're like the
Right.
I think you have it on your bio.
Let me save you from Dr.
Yeah,
Google.
let me save you from Dr. Google. But I think the one key thing, the one key element that we really stuck with is like your body tells you, your
Mhm.
intuition and your gut. Your
Right.
gut is telling
Yeah,
you
right.
something isn't right.
Mm-hmm.
So listen to that.
Yeah.
I think we tend to shut it down and we shut it up like, oh, no, it's not. But your gut tells you it
Yeah.
will. And I think Russ told me this a few times, and he kept mentioning something like, I just don't feel right. This just doesn't feel right. And I said to him, I said, well, we've got to just go see the doctor when we get back to Houston. Like, it's important that we definitely see that. But I'm so glad that he even like vocalized it. Because
Mhm.
even a lot of guys will not even vocalize it. They will keep it to themselves and say, oh, it's going to be fine. It's going to be fine. It's nothing. And then it's become something fatal or catastrophic.
Mm-hmm.
But if you verbalize it, or if you pay attention to signals or signs, like I see him every day all the time. If I notice him lagging for a reason, I know something isn't
Mhm.
correct. And
Mhm.
I will be like, okay, what's going on? What are you feeling? Is there something wrong? And at the end of the day, he's like, yeah, I do not feel right. Something is telling me that I'm sick. But it's so hard for us to accept.
Yeah. Yeah. I mean, that's where I think lowering the barrier and making it easy, like the
Uh-huh.
fact that I was a text away and he could say that to me,
Right.
I'm sure increased the chances that he was actually going to go see me. See a doctor.
The other thing I like about your philosophy to medicine, there's no extreme. I was overweight. I was 269, and I'm down to 242 as of this morning. I've changed my diet. I got off of, I took some wine classes over 2 years. COVID hit. Got a little stressed out because COVID was the antithesis of the way my brain does. Put on some weight, lost it, but you didn't tell me it's urgent. You didn't tell me it's dire. You didn't say I had to flip my script overnight. You just said I need to just cut down a little bit. Shave. You didn't use these words, but what you alluded to that day: shave off 10% here and there. Shave off
Yeah.
another 10% more. Just take it slowly. Do things differently in your life. Don't just go cold turkey. And I appreciate it because that's the hardest thing.
Yeah.
Just giving everything up. Because we work to live in this world, and you got to live a little bit. And some people have different definitions of how they want to live, and I didn't want to give all that up.
Yeah.
What you were telling me, just cut it down and just moderate it. And what I did want to ask a little bit earlier was back because I got friends in 40s and 50s, and we're all social drinkers, and we always worry about our liver, and I think our pancreas too. And what are some signs from those two particular? I know it's broad. I know medicine's very specific, but just generally speaking, what do you see overall when you have probably an issue with your liver, kidneys, or your pancreas from drinking too much? Something they should be
Yeah,
looking
I mean,
for.
if you just go to a doctor for an annual physical and you get a
Mhm.
basic set of blood work, to us it's like pretty obvious who's drinking too much from that.
Mhm.
Even if someone tells me,
You could just look
"I
at them.
socially, yeah,
The color of their skin.
that's true. You do tend to get like a ruddier, kind of more reddish complexion. I mean, there are little things like that. But some people just look like that, so try not to assume. But the labs really don't lie. Like the liver,
Mhm.
there's a couple of liver enzymes, the AST and the ALT. that will go up when someone's been drinking a little too much. Sometimes I also see some clues in their blood counts, like the red blood cells look a little bit bigger. So there's just little tiny clues that show up in the blood work when someone is drinking too much. And the amount that's recommended, or the max amount that's recommended for men is an average of 2 drinks per night or per day. So
it's better to drink during the day, not at night, right?
I mean, for the purposes of your sleep quality, that's true. Yeah. If you drink closer to bedtime, even though it may feel like, oh, it helps me get to sleep and helps me relax, it actually disrupts your sleep architecture. So you're not getting as high quality
later
sleep.
On in the night.
Right.
And it helps you fall asleep, like you said, but it's going to wake you up at 1 a.m.
Right.
Wow. This is really good.
Pancreas.
There
are pains in the stomach that friends can look for. No, it's just all blood work. A swollen pancreas or fatty liver doesn't cause any kind of abdominal discomfort.
Well, no. So, with the pancreas, with excessive drinking, you can get pancreatitis, acute pancreatitis, and that just means you have inflammation of the pancreas. Usually, people will get pain kind of in the lower part of their chest, upper part of their belly, right in the center. It can radiate into their backs. They'll feel kind of nauseated, don't feel like eating. That needs to be treated or evaluated by a medical professional, treated. But, what I see more commonly is just people who are chronically drinking too much and they may never get, actual pancreatitis. But you'll see it in their liver enzymes. You'll see that they're fatigued and they're not getting good sleep. They're having excessive calories. Blood sugar might go up. I mean, all kinds of long-term consequences from it. Yeah.
Wow. This is amazing. This is really good. And I think if anything, if you can just share this episode with the people you love, with everyone you think may need to listen to this episode, don't take your health for granted. I think we assume because we lead a happy, healthy lifestyle that nothing can affect us and that we're like immune to disease or challenges in our health. It's not like that. And I think this is a big reality check for all of us, and just someone that just assumes. I think we both do. We just assume everything's great and amazing and wonderful, and then it isn't. And I think the best thing is to be proactive in our health and seek out medical attention as soon as you feel like you need it, and you need to have that, because I think the consequences of not looking into it and not seeing what's going on and not addressing the issues are even greater at the end. And so the situation can become even more catastrophic than it could be at the beginning.
Because now I'm on, the consequences, I'm on blood thinners for minimum 6 months. And that's assuming at the end of 6 months, I got to do the blood work to check out. We're going to find out we're going to try to make an attempt to find out what caused it, but I can't do it now.
Exactly.
Because the blood thinners, as the doctor explained to me yesterday, alters or can construe the results a little bit. And so, but being on blood thinners, now I have to be careful. No contacts, sports, ulcers, right? I might eat something that can cause an ulcer. Then I have this internal bleeding issue. So, you just don't want to you don't want to be going through these kinds of things. So
and one of the doctors at the hospital said to us, said, oh, you may not be able to travel for a while. Oh, that was like killing him. No, you kill him if you say that to him. I sent him a message. It's like telling you like it's even worse than what you've gotten now if you can't travel anywhere.
That was torturous. I think all the blood rushed out of my head. I
would never casually say that to you. I would never casually be like, stop drinking wine and stop traveling.
Yes, that's what I said earlier.
The cardiologist at the hospital said that to us. We were like, oh my God.
Yes.
Yeah, well, so again, it's like knowing the patient and knowing what things you enjoy and what brings you pleasure and joy in life, and understanding that that's a part of the equation when we're deciding what we're going to do. And so for me to just suddenly be like, oh, those liver enzymes, just stop drinking completely. That's hard for somebody who just finished their, their wine class. So like I think that, having someone who knows you just has incredible value over popping into a random urgent care, doc in the box kind of place and seeing somebody who...
Doc in the box.
Yeah,
that's exactly what
big box healthcare. It's like,
big box healthcare.
Do you want to go to Walmart for your healthcare or do you want to go to the local mom and pop?
You want to go to the Four Seasons.
Well, no, and be an advocate for yourself too. Be an advocate for yourself and for the people around you, and learn how to advocate around a hospital, because that's a whole other
you could do a whole episode.
It is a shit show. The doctor and I had a close brief the next day. It is a shit show in the hospital. Literally, the left hand does not know what the right hand is doing. The ER room does not know what post-op or anything. They do not communicate at all. They are completely different wings of the building, and there was no communication whatsoever. It's just,
But at
I
the
do
end of
not
the
wanna-
day, honey, we're so glad this did not happen when we were in Africa, when we
Yes,
had
right.
no idea what was going on
Yeah.
in Africa.
Yeah, that would have been more work for me. So
Yes.
That would have
thanks for not being in a different time zone.
definitely another level of
I don't even think I saw any hospitals out there.
No, I don't.
And we were in the
think they're,
mountains.
Like, pretty
We were like 3 hours away from the middle of
We would
nowhere.
have needed a helicopter to get us out of where we were.
Thank
in the
God you were not more
jungle.
dramatic with your text from Sicily.
Yes.
Because you kept saying, I'm going to be okay until Monday, Doc.
Yes,
I'm going to be
yeah.
okay until Monday.
Yeah.
So I was like, okay, if he really feels like he's going to
Yeah.
be okay until
Well,
Monday.
I was finding ways to kind of make it work for myself.
Yeah.
And then I was, I'm the planner of the trips. So I'm starting to reroute where I'm going based on having to exert
Yeah.
less.
Mm.
And they had no idea. They're just following me. It's like, why are you going this way? I don't know.
I never know where I'm going. I just like,
Alicia-
where am I
Alicia
packing?
just
Is
shows
it
up.
hot or cold?
Shows up to the airport.
To show up to the airport. Thank you, Dr. Singh. We
You're
appreciate
so
your
welcome.
time
Thank
and
you for
going
having
over
me.
this.
We love
And
you,
I think we
doctor.
can, we
Aw.
do. We
Yeah.
love you. And anything that you all
Yeah.
have any questions about, go to her website. I mentioned it earlier in the day, and I also have a booklet on advocating for yourself in healthcare and in being in the hospital, just because I have just a ton of experience on that. And thank you so much, Dr. Singh.
You're welcome. Thanks for
And
having
thank you for sharing your story, honey. Thank you. Oh, you turned off your thing already.
I'm just glad to be here. I'm glad to be alive. I'm glad to be seen.
And I'm
today.
so grateful that you're here, baby. Love you.
Thank you guys. Appreciate it.
Thank you, Dr. Singh.